Good morning, everybody. Thank you for joining us. Mike Ziegler here, head of sales with FullBucket. And this morning I'm joined by our on-staff nutritionist, PhD nutritionist, Amanda Bradbery. Good morning.
Good morning. Thanks for having me.
You bet. Thank you for being on. And of course, co-founder and internal medicine specialist, Dr. Rob Franklin. Good morning.
Zig, what's happening, my friend?
It's great to be with you guys, and today we're going to talk about a very important subject in the life of a horse. When we look at these horses on the track or in a pen or roping or whatever, we really don't remember back to that 4 to 7 month period where stressful event called weaning. So, Amanda, we're just going to start with you from a nutritional standpoint. These horses, what are we looking for in these young horses where we're going to say, okay, it's okay to let's go ahead and wean this one? Where are they nutritionally?
So hopefully by the time of weaning, we already have those horses on some feed products, because maternal milk supply tends to start decreasing by about 3 months of age. So that gives us the opportunity to start transitioning those horses to a more solid food diet around that 3-month age time point. So we've already started adapting them to that type of diet, but weaning has a significant effect on that as well. So typically we've got them on a new type of solid food diet. They've got access to some long stem forage that they can learn feeding behaviors from the mare before the time of weaning. And then weaning time is going to vary based on facility and what management practices they choose to use. And it can be anywhere from 4 to 6 months. Some people even push that out even further to about 8 months. So really it's a choice based off of farm and management practices and what works best for you. It's more a matter of recognizing how we can prepare those animals for weaning by starting to give them access to those feed products.
Yeah, that's great. We've seen foals who were really healthy and were growing strong, and that we felt like we could wean those a little earlier, and then there's some that were struggling along that we've kept on the mom a little longer. So, and then Rob, from a veterinary standpoint, what do you recommend for these foals to have? Where should they be at this 4 to 5 months when it comes to vaccines and programs like worming and stuff?
Yeah, good question. And there are some pretty good general statements that we can make. I think Dr. Bradbery's right. There's a lot of farm preferences and I think that goes to discipline and also breed and geography on when those appropriate weaning periods might occur. Naturally, the weaning always occurs before a year of age. I've seen some clients not allow that to happen, and that's always a big mistake. But those colts, especially with the colt, as they just get unruly there. But if we think about what the veterinary recommendations are for weaning, we're going to start deworming at about 30 days of age, and then we're going to deworm, especially if you're at a breeding farm where you've got a high density of horses. We're going to typically deworm about every 45 days until worming, and I recommend deworming the mare and the foal at the same time. So the mare gets dewormed at birth, and then the foal at 30 to 45 days, depending on stocking density, and every 45 afterwards afterwards. Those roundworms have a pretty short life cycle, and you'll see those stacked up in those foals, whenever they'll get colony. So, in ill thrift as well. I think another important thing that people don't recognize with the parasites, and I've seen, some of those really high-end farms there in Parker County, Zig, and where people are just not taking control of something as simple as parasites. And those parasites, the intestinal worms, they actually have a life cycle where they migrate, the eggs are consumed in the mouth, they migrate out of the digestive tract, and they go through and they end up in the lungs, okay? And when they're in the lungs, they get coughed up, and the larva comes back and is swallowed in the mucus, and then they're entering different stages of their life cycle, but they do a bunch of damage to the lungs. And what's happening at the same time in that 4 to 5 month period is that maternal antibodies, that colostrum meal that provides initial protection for the foal, those antibodies are waning at that 4 to 5 month period. And what's happening is they're waning, the foal's natural antibodies are picking up, but it does leave them sort of in an area where they become very predisposed to illness, because maternals are waning a bit more than the natural production of the foals are rising. And so you end up with kind of an immunosuppressed period there. And it's also a period where they get stress, right, from the weaning process. And they're oftentimes in close quarters with other animals. So they're getting challenged from other bacteria and viruses, and they're getting and they're sort of immunocompromised and they're stressed. So it's really a perfect storm. And then if you have that parasite migration through the lungs, you're destroying the lung as well, or irritating the lung. And so you're really setting them up for disease. So one thing as veterinarians is we always start vaccinating the foals, and typically about 4 months of age, if the mare had received her pre-foaling vaccine. So most of our breeding farms are going to vaccinate the mares at 3 months, 5 months, 7 months, 9 months for rhino, cause of abortion. And then about a month before foaling, they're going to give that mare all of her annual vaccines, and that just primes that immune system to make a lot of antibodies for colostrum, right? And so if that has already occurred, then that foal should have a nice supply of a colostrum. We don't want to interfere with those maternal antibodies, because they make the response to the vaccine less, right? Because they go in there and they sort of bind to that vaccine versus allowing the body to naturally bind to it and respond to it. And so if the mare has been vaccinated pre-foaling, we wait till about 4 months of age to begin vaccinating the foal. If the mare was not, then that's going to occur. Then you're going to vaccinate the foal much earlier. And again, that's going to depend on the situation. So you really need to talk to your veterinarian about what's appropriate where you live about early vaccination. But do note that if you happen to inherit a foal, a rescue, or you get something you don't have any history about the vaccination, we see foals die of tetanus all the time, and that's an easily preventable disease. Not to mention all the other diseases that we can vaccinate, but tetanus is a real killer, and especially in foals that don't have any immunity from the mare. So important to talk about. But we're going to start vaccinating for things such as sleeping sickness, right? And so that's a viral cause of encephalitis. We're going to vaccinate for things like West Nile virus. We're going to vaccinate for rhinopneumonitis, which is a respiratory infection caused by herpes. We're going to vaccinate for tetanus, and we're going to vaccinate for influenza. We typically wait a little bit later for influenza, start picking that up at about 5 months. But all those sort of what we call a core vaccines, they're going to start occurring there at that 4 month, and then we're going to add rabies in there as well. So your veterinarian has a whole selection of vaccines that they're going to apply, again, based on geography, based on husbandry, other risk factors. But you need to be mindful, those vaccines need to be on board, and then they need to be boosted oftentimes 3 times before they have the proper amount of immune response. And if you wait to do that until after that stressful period, after they've been weaned, after they've gone through the parasite migration, and just all that stress, then those foals are going to get very, very sick. And pneumonia is a huge problem in this age foals. And so you're really doing a disservice if you don't get on top of those vaccines and start them early before the weaning process actually occurs.
Yeah, and do you like to see those foals have that booster, but actually before they're separated from mom, or how does that work? I know that it's been previously when I was in charge of Bob Kingsley's ranch, we would always want that booster done before separation, but I know it's a different with each veterinarian. How do you?
Yeah, I agree for sure. In a perfect world, you're going to have at least the second round of shots before weaning. I think sometimes situations do occur, especially in low density areas. As Bob's farm, for example, got smaller and went from having several foals, lots of mares, horses in training, there were lots of moving pieces there when you were running that ranch at the heyday. But as Bob got older, and he sold a lot of his horses. I mean, now you're dealing with one or two. They're just not under the same stress and pathogen challenge as someone who's over at a breeding farm, across the street in Parker County, right? So it is different. But ideally, yes, they'll have at least 2 boosters, and that gives them appropriate. It's kind of like this COVID thing where that second booster is when they say, okay, now you can relax, because it takes the immune system that first time, and then they recognize it, gets turned on, but the big response, the big vertical part of a bell curve on the immune response occurs after the second booster. Okay.
Yeah. Okay.
And oftentimes we'll give the third just because they respond very poorly to some of these vaccines at an early age, and so that's why there's a third for some of them.
Yeah. Well, so that's good advice. You've mentioned the word stress many times, and weaning has been described as one of the most stressful events in the life of that horse. And, we take into the consideration that it's only 4 or 5 months old. It's not fully grown. So, just staying with you, Dr. Rob, what is that doing internally to that horse? The stress that comes from, we've made it through the birthing process, and then we're finally able to stand and nurse, and then we're going to see other horses and get along. We're good at that, and we're riding through this gravy train, and all of a sudden, bye, Mom, no more milk. So what's happening internally to that horse you mentioned the word stress. I mean, that's...
Yeah, and people talk about stress, and I'll be honest with you. I mean, early part of my life, I heard a lot about stress. I thought stress was just like a psychological element, right? It's hard on your brain, and so maybe you don't sleep very well, maybe you're anxious, but what you understand, the more you understand about medical physiology, is that stress is actually something that's happening to your physiology of your body. It's not just psychological. And so, stress is there to get us out of a jam. So if you're lost, on a mountain, stress is there to get your adrenal glands going, secrete some cortisone out of your adrenal glands and some adrenaline, so that you can feel good and you can have lots of energy. But it's robbing Peter to pay Paul, right? So it's there to get you out of a jam. It's not something that's supposed to be prolonged. Whenever you have prolonged stress, then that has a negative physiological consequence. And the number one thing that we worry about is the response to the immune system. So the immune system gets, when you have naturally high levels of cortisone, the cortisone are actually immunosuppressive. And so that means that your immune system is weakened. And so we talked about respiratory diseases because those are things that we can vaccinate against. But the other thing that these foals are really challenged by, as Dr. Bradbery alluded to, there's a change that's occurring with their diet. But they're also getting exposed to GI pathogens, things that can cause GI disease, everything from stomach ulcers to colitis or infection of the hindgut. So all those things are really magnified with the stress, those risk factors. And so, we see foals getting both respiratory and GI problems as a consequence to the immune suppression, which is a consequence to the prolonged cortisone response from stress.
Yeah, we can see the physical stress, right? We see the foal running and nickering and running into the fence, and we can see that. But Amanda, we're not seeing what's going on down inside. And so you mentioned we want them on some kind of feed. They're going to be eating what mom's eating, or you've got a creep feeder. But typically during that weaning process, they're not eating much, right? They're stressed.
That's right. And I think Rob did a great job of introducing the physiological effects of stress. And And it's kind of goes back to the chicken or the egg, which came first. And it's this vicious cycle almost, where you have weaning happen, and that's a stressful event to begin with. Not only because their diet is consistently changing, their GI is adapting to new diets during this time. Their GI is still maturing even up to the time of weaning. And the GI plays a huge role in immune response. So if we have a compromised immune system from the elevated cortisol levels associated with weaning, then that's kind of a double-edged sword. We get another whack to the immune response, and another whack to that foal's ability to protect itself from the new pathogens and things that it's becoming exposed to. So weaning causes stress in a lot of different ways. It causes stress simply because we're taking the mare away. It causes stress because there's going to be completely new social dynamics. It's like changing a herd, same as in adult horses. You know, it's not just the weaning itself and taking the mare away, but you're changing the entire social dynamic that animal's grown up in. And that causes stress in and of itself and can change feeding behavior. You also have, sorry, go ahead.
Oh, go ahead.
You also have the diet changes, and the diet changes are just natural because you're taking away a supply of nutrients that they were previously getting and trying to replace that with solid feed. But even at the time of weaning, their hindgut's not fully mature, so their ability to utilize that long stem forage that we encourage them to consume is still fairly minimal. So they're still getting a large portion of their dietary nutrients from a concentrate feed. And like Rob kind of indicated, you have to be a little bit careful with some of that concentrate feed to be able to support that gut and not cause more harm than good in that feed selection. So it's kind of this vicious cycle of what causes that uptick in cortisol and maintains that uptick in cortisol for a long amount of time. And like Rob said, when cortisol is released or adrenaline on the short term is released, adrenaline's typically what's going to predominate when you see those foals running around and nickering. But kind of on the longer term, it's the cortisol response that is more of a sustained long-term stress response. And what happens is the vasoconstriction. So the vessels in the GI constrict in an effort to shunt blood to the extremities and the major muscle group in the brain for that foal to be able to deal with that stressful situation. And that can cause some significant implications as well, not only to the gut itself, but also to the overall immune response and health of the foal.
Yeah, no, that's great. Thank you. So that gives that inside perspective. Let's talk about some ways that you guys would consider for that weaning process. You know, there's the old traditional abrupt method, and then there's a gradual method. And if you, Amanda, how do you feel about either of those ways, and talk about how they affect that horse individually?
That's a great question. And really it's going to differ by facility and how they choose to manage. But if you're thinking from a physiological stress response, if you do abrupt weaning where you remove the mare from the foal's environment, and she goes away from sight, smell, and sound of that mare or of her foal, then you shorten the stress response, but the stress response is peaked higher. If you do a slow, gradual weaning, you typically don't get the big adrenaline response, but you get a longer sustained release of cortisol because you're extending the length of that stressful time period. So, you know, both are going to cause stress. It's just whether you want to get that stress over with more quickly or you want that to be longer and sustained. I tend to recommend more towards the abrupt weaning side of things than the slow and gradual. But again, there's going to be some differing opinions on that. And, you know, one's not necessarily better than the other from a physiological response. But one thing I do recommend is removing the mare from the foal's environment rather than removing the foal from the mare's environment. That way we're not also changing the foal's whole lifestyle and environment. The mare can handle that stress a little bit better than the foal can. because she's not growing. She's just got to deal with that stress, and we can get her back from that a little bit easier than we can from the foal. So that's probably the most consistent recommendation that I make from a weaning perspective is keep that foal's environment as similar as you can, even though you're removing the mare.
Yeah, great point. And to that, Rob, we would have some recips that we couldn't wait to move on out, and so we would wean that baby and put that recip on that trailer and say goodbye to her. And so that's the abrupt method, and it is quicker, like you said, Amanda. Rob, how do you feel about those two ways to wean?
Yeah, it's just the Band-Aid's got to come off, right? Are you gonna rip it off, or are you gonna just slowly try to peel it off a little bit at a time? And I tend to be a quicker ripper offer, get it done, get it over with. And Amanda is an animal scientist, and so she spent a lot of her time, studying the research that's been done, the physiological work associated with husbandry of horses, and so her being able to produce that data that shows that the physiological peak is higher, but it's shortened by the ripping off the bandage. I think that's valuable for a horseman to be able to know that and to be able to make their husbandry based off of some scientific data.
Yeah, and then as far as in the environment, right? So Amanda mentioned that we want to keep them as in what they're used to, right? We want to keep them in it. But as far as environment, what are we looking for when we're going to wean? I mean, of course, we're going to walk around and look for rocks and things like that. But these horses are herd animals, right? And so there's different factors that come into that weaning. Are we have one baby? Do we have four? As far as the environment, Dr. Rob, what are we looking for? What do we need to be aware of in their surroundings when we're going to actually wean?
Yeah, I think safe and familiar are probably the two big things to take away. So as you mentioned, scouring the area for those little pitfalls that foals love to find themselves, or weanlings love to find. Whether that's a piece of metal or a tin around, or a proud nail somewhere, or they're going to tear themselves up during that time period because they are running the fences. They're just really getting in trouble. So I like to keep them in a familiar surrounding and make sure that it's extremely safe, and make sure that we provide some level of social activity for them. So it can be hard when it's a single. It's a really small operation, because that it is hard to do anything if you just have a mare and foal and you've got a wean. So that's probably going to lend itself towards that slow peel of the Band-Aid. But if you're in more of a commercial operation or something like that, I think you're going to be able to group that foal with some other foals and be able to provide it with some social aspect as you quickly remove that mare.
Yeah, and Amanda, as far as feeding, that we're going to have out there what they've been used to, and like we mentioned, that they're probably not going to touch it much during that peak stressful point. But what are you having out there for that first day of weaning foal?
Yeah, so I want them to have access to the same feed that they had access to before we remove that mare, at least until we get a decline in that stress response. So it's got to be at least a couple of days, a week or better, before we're going to even consider changing the diet of that foal. Now, every farm's going to be a little bit different, whether that's a creep feed mechanism or they've actually been meal feeding those foals. It doesn't really matter too much. At least the research doesn't say it matters, or there's nothing in the research that says one is necessarily better than the other during weaning time, as long as we're meeting their nutrient requirements. But with that said, just staying consistent, at least for that first week after you wean them. Then if you want to start making some changes, then we can talk about making some changes. But again, those changes need to be slow and gradual over time, because we've changed herd dynamics. We've removed the mare, which has on its own changed that horse's diet, even though they've already been consuming that concentrate and a little bit of that long stem forage that we've been providing. We're still taking away a piece of their diet. So it's still kind of like that adaptation period where we need their GI and everything to get used to that change. And we need that physiological stress response to kind of tamper down a little bit. After that, then we can start making some significant changes to their diet should we need to. But again, it's important to recognize that the foal's hindgut is not fully developed at the time of weaning. So a large portion of their nutrients still need to come from concentrate. And I know we talk a lot about, not feeding concentrate if it's not necessary. Forage is the base of the diet. And that's very much true, but it's true once their hindgut is developed and able to actually ferment and digest and utilize the nutrients that come from that long stem forage. Still important to provide long stem forage to these horses because that's part of what helps that hindgut complete its development process and fully mature and develop those microbial populations that are necessary for further life. But they're still going to be getting a lot of their nutrients from that mare and foal feed.
That's great. That's great. So let's talk about warning signs here from a veterinary standpoint. Dr. Rob, when do I, as that horse owner, say, hey, something's wrong here? What am I looking for? We know that, as you mentioned, they're going to find anything to cut their nose on or bang their knee or But at what point should I say, hey, this is not right? And then what should we do?
Yeah, I think the two big things that they're going to encounter that are going to put them in a hole is going to be a respiratory infection or diarrhea. Let's just say GI disease, because they can actually get. I've seen foals rupture gastric ulcers before, and they die whenever that happens because they get peritonitis. All the stomach contents enter the abdomen and they get peritonitis. So anything from the gut or the respiratory tract. So respiratory tract signs you may see, like down here in Texas. One of the first things you may see is really labored breathing. Anytime it's hot out, you're using your respiration to blow off heat, and whenever your lungs are inflamed, they're not able to do that as well, and so you see a foal really huffing and puffing. That's a sign they've got respiratory disease. Of course, a snotty nose, a cough, taking their rectal temperature and noting a fever over 101 degrees. Would be considered a fever. Now, again, if they've been standing out in a sunny field or they've been running around with all their herd mates, and you take their temperature in July and in Texas, they're going to be over 101. So if you're taking their temperature and you're trying to assess if they have a true fever, you need to bring them in. If they're outside, you need to bring them in and let them acclimate a little bit before you just jump to conclusions there. But fever is a consistent sign of problems. And then on the GI side, you may see a foal grinding its teeth. That could be a sign of some abdominal pain, especially associated with stomach ulcers. And you may see in severe cases that you can actually see them reflux out their nose. So sometimes foals will get a duodenal ulcer that will result in a stricture and their stomach cannot empty. And so their stomach gets big, and then they begin to have a little bit of stomach contents leak out their nose because it can't go anywhere. Again, that's a very, very severe condition, but it does occur. And then, otherwise GI stuff, we may see some weight loss that may be associated with something like internal parasites or an infection from a bacteria called Lawsonia that occurs typically weanling aged foals, weanling to yearling aged foals. You may see some edema pop up where they've lost protein from either parasites or Lawsonia. So as the blood protein, it typically has a certain level. Parasites and some infections can cause a protein losing intestinal condition. And when that occurs, then you begin to stock up. and you get edema. And so foals will get edema in their throat latch, under their bellies, back around their sheath. Those can be signs you've got a severe GI problem. And then, of course, you've got obvious signs when you've got diarrhea. And diarrhea can be from things such as sand ingestion. It can be from parasites. It can be from bacteria and viruses. And so those things are tend to be pretty obvious when they occur. But then some of those other conditions that we talked about vaccinating for, those, if they develop a neurological problem from sleeping sickness or West Nile virus, and those are going to manifest themselves as maybe a coordination, maybe not appearing orientated very well, depression, somnolence, or being very sleepy. And then you have tetanus, and tetanus is a real killer. Remember, tetanus typically starts off with them being the muscles being very rigid, and even the third eyelid that sits in the corner of the eye will stay extended, covering the inner portion of the eye. That's a consistent sign, and they kind of walk like a tin man. But oftentimes foals will just become recumbent from tetanus, and then they get that rigid sort of sawhorse recumbent deal, and that's very hard to save those foals.
Yeah. Okay, great there. And then Amanda, as far as we talk about the gut, and then the 60-70% of the immune system down in there, in the microbiome. What are some warning signs? What's happening down there? What do we need to look for and be aware of?
Yeah, I think Rob hit the nail on the head. You have to look for those classic signs of colic-like symptoms, abdominal pain, any type of discomfort. Diarrhea obviously is going to be a really easy to notice sign. Foals will get diarrhea so bad it'll spray the walls, and they tend to progress to that point a little bit more quickly than some of our mature horses that have a little bit more of an established GI. So diarrhea is definitely a sign. Any sign of colic. Lethargy is going to be a big one. Foals tend to have a lot of energy and be ready to run around and play. And if you've got a foal that just doesn't want to do that, then that's definitely going to be a sign. I always tell producers to keep a record of rectal temperature. And kind of like Rob already talked about, if you don't know what's normal for your foal, then it's hard to know what's abnormal unless you get to plus 102. There's normal circadian changes or daily changes in rectal temperature. It's typically the lowest in the morning and the highest in the afternoon. Even in colder environments, like I'm up here in Montana, and we'll still see, even on a cold day, the highest level of rectal temperature is going to be late afternoon. And in the heat, kind of like Rob said, it's going to be over what that normal range is when it's over 100 degrees outside and that foal's standing in the sun. So if you don't know what's normal for your foal, then it's hard to know when you're on the early side of potentially catching something before it gets to become a problem. So I always tell people to keep record. If you're bringing those foals in every day to have a meal, it doesn't take you more than 30 seconds to get a rectal temperature on that foal. And it's also good from a training perspective. If those foals are willing to stand at their feed bucket and let you take a rectal temperature on them, then, it's also got a training piece to it as well. So know what's normal, and then you can tell what's abnormal.
Yeah. Great advice. Okay, so here we are. We're taking all these precautionary measures. We've gotten the worming program started. We've done the vaccine, and we've boosted. And the foal is having creep feed, and the foal is growing up. And so we've checked the pen where we're going to wean it, and we've got a plan to either take the mom away or do it gradually, or we're all prepared here. And, at FullBucket, the gut leader, health gut leader, we're not only here to help, we're not only here to solve problems, but also prevent. So, Dr. Rob, what would you say we could do as a horse owner? We've taken all these steps. What can I do to help that foal push through? We talk about, you said the word GI so many times here. What can I do as a horse owner to help that foal from a gut standpoint as far as a FullBucket product?
Yeah, so we talked about doing a lot of things. We talked about, and I'll get to your question. I just like to really make a holistic recommendation rather than a product recommendation. And just to recap, we talked about minimizing stress. Stress is real. Minimize it. We talked about protecting them in their surroundings. Talked about making a social landing strip for them. And we talked about getting their gut adjusted, getting their immune system adjusted with vaccines, getting rid of parasites. So now, you're right. We talk about gut. And we talk about gut not just because FullBucket is the leader in gut animal supplements, but because the gut is a huge part of what goes wrong and is responsible for keeping things right in all animals. And even more so in horses, because horses have such a complex gastrointestinal tract. So what can they do? I think that when you start creep feeding a foal, you should be adding the FullBucket probiotic pellets to your creep feed. By doing that, you're going to be protecting and fortifying that microbiome as it's trying to adjust to digesting long stem fiber through fermentation, as it's trying to take these essentially foreign nutritional sources, with some oats and some of these things that we're going to get in a mare and foal food. I mean, they're not used to that, right? And so they've got to adapt to that. And so having the probiotics in there really helps them adapt to it. Having the prebiotics also helps stimulate the immune system. So the immune system is responsible for about 70% of the gastrointestinal tract is responsible for about 70% of the immune response in a horse. And so prebiotics are essentially little immune stimulators. They go by and they tell the immune cells in the lining of the gut to turn on and to watch out, right? So they stimulate the immune system in a positive way. And so prebiotics, probiotics, and then the L-glutamine, which L-glutamine is just an amino acid, but it's the amino acid that the cells that line the intestinal tract live off of. And it's called a conditionally essential amino acid, meaning that in times where you're not eating and you're not taking in a balanced diet, your gut cells are going to be longing for this nutritional source of L-glutamine. And so if you think about a foal's not eating well during weaning, it's irregular, it's stressed out, it's thinking about everything else. Those enterocytes, so the lining cells of the gut, they're hungry and they're starving, right, for what they need, and that's L-glutamine. So by doing the probiotic, prebiotic, and L-glutamine combination, you're really helping protect that GI tract. So I think by adding that simple pellet, just a small scoop of that to your mare and foal, your creep feed, early on. Don't wait until weaning, like the day of weaning. Okay, now I'm going to have the probiotic. That's a little too late, right? That gut, just like when we change the diet, everything needs to occur slowly because that gut is a big ship. It takes time to turn, right? And so we want that ship turned all the way and have the immune system and the microbiome balanced out before we hit that stressful weaning period. Don't wait till then. So I would suggest, when you start introducing that creep feed, just go ahead and introduce that probiotic pellet and just maintain it throughout the weaning process. And it's really going to help keep those foals from getting sick, from colic, from getting gastric ulcers, from getting diarrhea. Just so many pluses to that simple addition.
It's great advice. Just those last three things you mentioned that are bad for those young horses. I mean, gosh, just these little simple measure, Amanda, of just adding the probiotic pellets to that to help prevent those things. That's an ounce of prevention, right? That's a great step. How do you feel about that?
It is. And Rob, I love that you called L-glutamine a conditionally essential amino acid. I'm really glad that, what was previously called non-essential amino acids are now shifting, because we know that yes, the body can produce those amino acids that were formerly known as non-essential amino acids, but supplementing those additional to what the animal's body can produce can have huge benefits, and they can be essential in certain situations, which is why that term is now shifting to conditionally essential amino acids, and I think that's great. And providing that support for the GI, which is then going to support the immune system, which Rob already said, it contributes to almost 70% of the immune response. If we can target 70% of the immune system just by supplementing 3 good ingredients to these foals, then that's a really easy way to help combat some of that stress that's already going to happen. And it's always important to consider that we have to supplement these things before the stressor happens. For the GI, it's a minimum of 7 to 10 days, but ideally about 28 days before we introduce any type of stressor, whether it be weaning or transport or anything that we see is going to happen or anticipate to happen when we can. We want to have those horses on that supplement for about 28 days so we can get the maximum benefit from it. And I think pre and probiotics and the L-glutamine are hugely beneficial for combating stress. And even in other species, it's been found to help prevent or improve the immune response to respiratory diseases. So even though we're supplementing something for the gut, we could also almost be benefiting that respiratory system as well, just by targeting the immune system and the immune health. But then we're also helping the GI mature and just be able to deal with the diet that animal is going to be on for the rest of its life based off of long stem forage. And so if we can supplement something to kind of help that maturation process and support gut health through that maturation process, then we can see some lesser effects of weaning.
That's great. That's great advice. And, we'll wrap it up here. And first of all, I want to thank you both for jumping on and sharing your expertise on this subject. Again, we think about these periods in the horse's life. Well, this is one of the most stressful events, and it can be stressful for owners too, right? So you guys have provided great advice on that side, and then the action item here for you guys, for the people listening to take that advice and get the probiotic pellets, get them started early and go through that weaning process. And we're going to provide a link at the bottom after this audio, and you guys will be able to click on that and take advantage of a special offer that we're going to have for this weaning process. And so again, Dr. Rob and Dr. Amanda, thank you both. And we really appreciate it. Thank you.
Thanks, Zig.
Thanks, Zig. Good to see you, man.